This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning, welcome into the program, and today, Mon Health Talk turns into the Monongalia County Health Department 101. Got a full house. First of all, please welcome Dr. Brian Huggins, the Monongalia County Health Officer. Dr. Huggins, good morning, Brian. Good to see you.
Good morning. How are you doing today?
Buddy, I'm doing all right. We got Sam Chico, Board of Health President here in Monongalia County. Hey, Sam, how are you?
Fantastic. Thank you for having us.
And we got, Mary Wade, I'm totally blanking on your last name, and I should know it. Burnside, right?
Correct.
All right. It came to me as I was talking. Mary Wade Burnside, Communications Director?
Public Information Officer.
Public Information Officer. I took a shot. I knew you've got one of those titles that means you do a whole lot of things. That's what it means, Mary Wade.
That's correct.
All right. Well, guys, hey, thanks for joining us in studio today. And we did that, about a month ago, I guess, Brian. We talked about the County Health Department. We're going to do this each month, highlighting the health department. So I guess give us a broad overview, Brian. Everybody knows there's a Monongalia County Health Department. Give me the broad overview of what you guys are all about over there.
Sure. Yeah, a lot of people have no idea what we do. Sam was actually telling me a great story when we walked in a little bit.
Whenever I didn't know what we did, quite frankly, I was on a trip. I was invited with my father to go to a horse race with his buddies, and I didn't realize why they invited me, but they invited me because a couple of his buddies had Alzheimer's and they would wander away, and they wanted me to corral them whenever. But on the trip over, they told me I should be doing more public service and I should volunteer at the health department. I fell for it, and all I thought was, well, I know they inspect the hot dog stands, and I thought I can handle that. And whenever I got my indoctrination, I was absolutely stunned at the depth and breadth and the importance of the critical services that they're providing to the neediest of the needy, and it was just in awe. And then seeing people that enjoy the rewards of helping and giving back over monetary rewards, because these people are highly trained, highly educated in the medical field. They could make plenty more elsewhere, but they choose the public service element. It's really inspirational. So
it's really great. I mean, what do you know about it? Tell me what you know.
I'm a bit of the exception to the rule because I deal with you guys on a pretty regular basis. But I would describe it like this. There are medical services, so there's health services, dental services. Obviously, there is the component Sam mentioned, inspecting hot dog trucks, but there's environmental. Certainly, we spent a lot of time during 2020 talking with the health department.
We call those the dark years?
Yes,
we're just going to call those the dark years.
But the health department was the place to go to get some information, to kind of try to figure out what's going on. So there's a lot of things.
There's a lot of things, and you hit on it. And really what Sam was talking about, the average person in the county honestly doesn't know what we do. If you've ever owned a restaurant, if you own a swimming pool, you probably know who we are because you have to get inspected. A lot of people don't realize that to get an alcohol license, you have to get a public health certificate to operate before they're going to issue you an alcohol license. But we actually offer everything so we have basically 6 main programs under the health department. We have clinical services, we have dental, and we're one of the only health departments that actually has dental. We have infection control, we have environmental health, we have WIC, Women's, Infant, and Children, and then we also have threat preparedness. And so, I'll go into a little bit about each one of those real fast. Clinical services is where you could come in and we have family planning, we have STI testing. A lot of people just don't know that. I wish I knew when I was younger that there is this place that you could go and you could actually get tested for, sexually transmitted infections. And it's free. It's available. That's just an awesome thing that younger Brian probably would have appreciated knowing existed. I always thought, I've got to go to my primary care provider and they know me and it's awkward. We're able to do those types of things very easily. Family planning, we offer birth control, we offer Plan B, things like that. We also are offering PrEP now, HIV PrEP. So HIV PrEP is basically a medication you can take before that you have sex, and it actually helps protect you from HIV, and that's the service that we're offering. I personally offer travel medicine, I offer immigration exams, and I offer FAA flight physicals. So I'm actually able, for the pilots that are out there flying commercially, you can come get your physical from me, because they have to do it every 6 months to a year. And then a lot of those services, I just want to go ahead and pitch in that we do offer sliding scale. So for people that have lower incomes that need some of those services, we do have, in the state provides us the ability to provide some of those services for free. So that's awesome. Dental we have full service dental. We have dentists, we have hygienists. We even have this really awesome RV that goes out called Smile Express. And I'm going to let Mary Wade talk a little bit about what our Smile Express does.
All right, Mary Wade, what is Smile Express?
So we started our mobile unit in 2018 with a retrofitted used RV, and we're very happy to announce that as of a few weeks ago, we got our new one, our custom-made Smile Express RV. And our coordinator, Tiffany Summerlin, she was able to specify exactly what she wanted, having been in the old RV for 6 years. So it's custom made, and it goes to 5 counties and goes to all the schools there. And then we've started to do recovery centers. And this week, the new Smiley will be going to recovery centers. I was actually able to visit one of those and be there for their visits. And the people were they were happy to talk to me about it. They're extremely grateful. And it really, they're trying to change their lives and turn their lives around, and just getting their teeth cleaned and kind of making a plan for any work that needed to be done. It just really boosted their spirits and their confidence.
It really makes a difference in their life. I mean, if you think about it, somebody that's in recovery, that's potentially had just a hard go at life, they're addicted to drugs, and your dental care has gone. When you're sitting across from someone in an interview and they have bad teeth, it's prohibitory to hiring sometimes. I mean, it's just something that we don't even think about subconsciously, and to be able to actually get care and to sometimes get that care for free, it just can change. It can make all the difference in the world in getting someone to the next step.
Our guest this morning, Dr. Brian Huggins, Monongalia County Health Officer, Sam Chico. He's the president of the Monongalia County Health Board, and Mary Wade Burnside. She's joining us as well, the public information officer for the Monongalia County Health Department. Got to squeeze in a break. We'll do that. We'll continue our conversation right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Today we're talking about the Monongalia County Health Department. Dr. Brian Huggins, the Mon County Health Officer, is in studio with me. Sam Chico, he's the president of the Board of Health, and Mary Wade Burnside, the public information officer, joining me as well. Folks may have noticed, maybe they didn't even know they noticed, I think it was Thursday, your quick response team volunteers and members of the Monongalia County Health Department were out and about several locations here in Monongalia County, handing out free naloxone kits, part of Save a Life Day. And it's, again, part of one of those things, Brian, the health department does, maybe folks aren't aware of.
Yeah, it's really awesome. It's really built into a statewide effort where we know that putting naloxone, also called Narcan kits, into people's hands saves lives. We know that. Unfortunately, when I was not in West Virginia, but when I was living in Dayton, Ohio, I had 2 different neighbors that had OD'd. One of them OD'd on their front lawn across from us. And I didn't have a Narcan kit. So being able to have that, you just never know, unfortunately, in today's society when something like that's going to happen. And to be able, it's very easy to use. You put it in the nose, you spray it, and it brings people back. And that's just one of our many efforts. I love the T-shirt. I don't know, did you guys get a chance to see the T-shirt they designed this year? It's really awesome. They put the cryptids. It's got Mothman, and they think, anyway, it's got a couple of the cryptids on it. And I love that the cryptids right now are a big thing. And I'm a Halloween guy, right? So, but that's just part of our threat prep effort. And our threat prep guys are just phenomenal. They're my doom and gloom guys. So they're the ones that are really going to keep us safe, thinking through things. When you think about human services during a disaster, that's what they're all about. They're going to get you water. They're going to get you food. I know everybody remembers the dark years, and they were there to try to help with that.
They were the first ones in and the last ones out, and they weren't fearless, Gully G.
Absolutely. Absolutely. And so those guys, though, if we have floods, like right now you're seeing in North Carolina, what the hurricane did there. If the hurricanes came to West Virginia, we'd be seeing the same thing. So they're there every day planning, ready to go. I love those guys. Go ahead.
Well, I was going to shift just a little bit of the conversation while we have a few minutes. This goes by quicker than you think. Well, you were warning us. We all know it goes by quicker than you think.
Fast.
Sam, since you're here, I wanted to bring you into the conversation. Give people a little bit more of context of the Board of Health and what you guys are tasked with doing, where your authority comes from. Just give us kind of that idea of what the Board of Health is all about.
So there's a segment of the West Virginia Code, 16?
Chapter 16.
Chapter 16, and that it requires that each county to provide certain services, and in that it form a Board of Health, and then it gives them the primary responsibilities. I think it's 5 that the good doctor here just touched on. And so the Board of Health is formed. I've been on the board, golly gee, nearly 20 years or 20 plus years. And we've come a long way. We've I would say that with tremendous, like I say, we've put very good people in positions of the project management of each department. And I've always had a management philosophy of finding people smarter than me and more educated than me and more experienced than me, and give them a framework to thrive. And I think that it's worked very well for the health department. And we've been blessed with Dr. Huggins and his predecessor, Lee Smith, who carried us through the dark ages and really elevated each department. And then I just can't believe we found Dr. Huggins to come in. And so we do different things. One example is we created a regulation like the Clean Indoor Air Act, which was transformative for the community. I think it made all the restaurant and bar experiences better. I think and it was a very arduous, challenged. There was a lot of pushback on that.
So what is the Clean Indoor Act?
So the Clean Indoor Act protects people from secondhand smoke and from smoking environments in public spaces. And if you don't remember what bars and restaurants were like, or even bowling alleys, if you'd go in and for starting a good time, and you'd walk out with your white shirt would be off yellow, and nobody really knew why. And what was funny is some of the bar owners and the institution, they fought this tooth and nail. And then a couple of years after it passed, we didn't hear much, and somebody came up and they wanted us to weaken the code. And of course, I get phone calls from the guys who really badgered me, pushing back against this, and I was dreading the phone calls, but I've returned their calls, and they were like, "Sam, don't you dare loosen those rules. It's the best thing you ever did." I'm like, "You called me every name in the book a couple years ago." "Yeah, but," he says, "I didn't realize."
Now you're Sam, so that's good.
That's
better.
My middle name was something else before.
Joining us in studio this morning, Sam Chico. He's president of the Monongalia County Board of Health. Brian Huggins, a health officer for Monongalia County Health Department, and Mary Wade Burnside joining us as well, public information officer. Got to take our final break. We'll continue the conversation on the other side. This is Mon County Health Department 101 on Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got a couple of more minutes here with Dr. Brian Huggins, Monongalia County Health Officer, Sam Chico. He's president of the Board of Health, Mary Wade Burnside, public information officer. We don't have to spend a ton of time because it will get in the weeds talking about regulations, but there are a ton of them, Brian, and you all have to follow them, and you have to make certain others follow them as well.
Correct. Yep. So we're mostly guided through Chapter 16 of the state code, which outlines you need to provide certain services, and we need to regulate certain areas like restaurants, tattoo parlors, pools and spas. A lot of people don't know there are over 100 pools and spas in Mon County that we have to inspect every year, and they have to get inspected before they open up. And so we're bound by those regulations. And then our governing body is the county commission. So it's a little complex, and you're right. It'll get in the weeds, and I don't want to, and this is when your readers are going to go to sleep. So we have the county commission, who is our immediate governing body. However, we do have the state board or the state Bureau of Public Health, and the commissioner of that bureau, Sherry Young, and the state health officer, who also provide guidance to us. They are allowed to, if for some reason our local board of health or the county commission, they feel that we are not doing our job, then they have permission written in by state code to insert themselves from the state level into our local area. Hopefully we're doing a good job. I think we're doing a good job.
You're doing a great job.
Yeah. So, yeah.
Let me use the pools and spas as an example.
Perfect.
All right, I got a pool in my backyard, Brian. Yep. It's my pool. I swim in my pool. Nobody else swims in my pool. So why does the health department need to come look at my pool?
They don't need to come look at your pool. It's only public pools and spas. Excellent clarification point. However, if you have a septic tank, you do have to have us come out and make sure that the septic tank is correct.
All right, well, let me stick with the pool example then.
Okay.
What do pools and the health department have to do with each other?
So chlorine is a very dangerous gas. A lot of people don't know that. In fact, and this is where my history nerdness comes out, is that chlorine gas was the first chemical weapon used in World War II. It was the first chemical weapon really that they know was used at all in a major situation. If you're exposed to high levels of chlorine gas, it will cause pulmonary edema, which basically means fluid in your lungs, and it will kill you. So when we're chlorinating water, if you don't have enough chlorine in the water, if somebody has a baby that takes a dookie in the pool, then obviously that's going to create problems. So you have to have this fine balance of between disinfection and harmful to people. And that's our job. Our job is to make sure that that pool is safe for you to get in. Everybody's heard of the hot tub that you get into, and you end up breaking out in the rash and you're itchy. It's called hot tub folliculitis. Hot tubs are they're kind of the devil. They just are. I love a hot tub. Don't get me wrong, but I've seen on many a hotel that you come in and they go, oh, we think there's something, and they just cement over it. They're like, I'm done with it. I'm done with the hot tub.
Also, when mixing chlorine in water is hydrochloric acid, and improper handling of it could be problematic.
Is it fair to say, Brian, with regards to the health department, wherever the public gathers, the health department's going to be there in some, to borrow the governor's cliche, some shape, form, or fashion? Is that fair to say?
It really is. Public health is public safety. Mm-hmm. It really is. And I think that's an excellent point. I think that if you really think about anything where people might get sick, people might get harmed, there's a good chance that we have somebody that's there, that's watching it and trying to protect you. And with that note, if you think you see something that's a problem, you can report that to us. So if you see a restaurant that you're like, this is just gross, I see cockroaches, I see, it just doesn't seem like you can report that to our environmental health folks, and we will go check it out. Like, that is what we do. That's our job, and we're happy to do that.
And I think it's a testament to what a good job they do by the fact that nobody knows what we do. We instead of being overbearing and a presence and a burden in people, being that we are able to keep people safe, and we're working in the shadows and not interrupting. I think that it's a real testament of the job that they are doing.
Brian, we've got about 40 seconds to wrap things up. What do you want people to take away from our conversation today?
We're going to be here every month. Last Monday of the month. Thanks again to Dave Goldberg, CEO and Mon Health. And next month, we're going to be talking about myths around holidays. How worried should you be about needles in your candy? What are the risks of frying a turkey? We're going to cover all that.
I think that was always a myth, just so Dad could have some more candy on Halloween. I think that is. All right, hey, guys, appreciate you coming in. Enjoyed the conversation. Thanks so much. Look forward to seeing you in a month.
Yep, see you then.
Sam Chico, Board of Health President. Brian Huggins, Health Officer here in Monongalia County. And Mary Wade Burnside, the Public Information Officer. Guys, appreciate it so very much.